they have found beneficial for pain and other reasons. Some people are literally dying, and they're dying with tremendous pain, and this can, in many cases, literally stop it. And they have their senses about them, as opposed to painkillers, which don't allow that, don't allow them to die with dignity, frankly. I promise to be the president of common sense, and that is exactly what we're doing. This is really something having to do with common sense. And it's something having to do with the fact that so many people that I respect ask me to do it. People that are having problems, big problems. They are having big problems with illness, with cancer in particular. I now want to ask Dr. Oz to say a few words, followed by Dr. Braun, Dr. Casseret, Dan Wiley, and Dr. Valcow. And we'll sign the order as soon as they're complete, and we'll take some questions. Please, go ahead.
Mr. President, thank you for always bravely pushing for common sense change, as you call it. So President Trump, Secretary Kennedy have been pushing for change. They're passionate in their desire to help the American people, and they have relentlessly pursued this agenda throughout this administration. This also includes a deep passion for research, gold standard research, as Secretary Kennedy also says. But there's another side to the president that often isn't reflected in media reports, and that's the deep passion he has for the people in his life. And he has called me frequently about the people who are calling him, as he alluded to, who are saying that they've got problems and they got relief from some of the solutions we're talking about today. Howard Kessler, who's standing behind me here, who's a mutual friend of ours, was an early caller of the president. Many others have ever reached out as well. And Howard's been a passionate advocate for avoiding narcotics, especially in seniors, and particularly seniors suffering from cancer. And that's a population that is a very important one. And it's a sympathetic population that's desirous of trying new ways besides some of the conventional approaches that have been tested by pharmaceutical companies but have untoward side effects. At the beginning of the year, one of the first things the president told me, he doesn't actually tell you, he demanded from me, that my agency, CMS...
Nobody demands from him.
No.
Nobody. You have to know him.
That's right.
Go ahead.
Use the whole tools at his wherewithal to find a better way to help seniors. A passion for a population that has gotten left behind with these discussions. I promised that we would find an answer, even though it had not been done before, and today we are delivering on that promise. Today, our Innovation Center at CMS is announcing a new model and additional actions to give seniors access to cannabinoids. These are CBDs. They're non-addictive, which many are already using to manage pain. There's some clinical evidence that's showing that CBDs provide relief from common conditions that affect Americans, including cancer symptoms and chronic pain and a slew of other problems that affect disproportionately seniors and our veterans. And 6 in 10 people who use the CBDs report that they improve their pain. I think all of those people are calling the president, judged on the number of calls in support of what we're doing today. And sometimes these decisions are difficult, and there's a reason this hasn't happened before, and there's a reason, Mr. President, that every president before you has whiffed on this issue. It's tough. And I know there's going to be a lot of discussion about it. That's why we're so passionate about making it clear that this patchwork that we're working within now, the laws and regulations, they're leaving patients and doctors without adequate guidance on the safeguards of how to use these products, even though they're still being used. At Medicare, we cover 68 million Americans, including people under the age of 65. And they did not have a way of providing these treatments until today. With the president's insistence, that's all changes. The Innovation Center models are going to allow millions of Americans on Medicare to become eligible to receive CBD as early as April of next year, and at no charge, if their doctors recommend them. Thanks to the hard work of the entire CMS team, especially Abe Sutton and Gita Dio at the Innovation Center, the accountable care organizations in this country working in Medicare will be able to provide these products, again, at no cost to patients. Medicare Advantage insurers, and we've been calling them, are also agreeing to consider CBD to be used for the 34 million Americans that they cover. If you can hear my voice and you're over 65, you should pay attention to this executive order because it's going to touch your life. Again, this all becomes active after the first quarter of next year. These CBD products must first meet local and state quality and safety standards. They must come from legitimate sources, and they must abide by other regulations of those states. With these boxes checked, patients can be eligible for up to $500 of hemp-derived products each year. This is the first government-led testing of quality and outcomes for patients across different conditions.